The bipartisan efforts of forming the task force was established by Public Act 13-3, an act concerning gun violence prevention and children's safety passed by the General Assembly in response to the tragedy at Sandy Hook. A major thrust of this act was to take a critical look at behavioral health services for young adults, determining how those living with mental illness can be identified and given the help they need to live safe and secure lives. The 20 members of this task force, many of whom are here today, include professionals in associated fields working in state government, the private sector, as well as consumers. From August 2013 until April 2014, they worked to confront the complicated issues surrounding behavioral health. We thank them very much for their efforts and their service to the state of Connecticut.
Although Connecticut has many examples of excellence in specific adolescent and young adult mental health programs, the task force was concerned that Connecticut's overall system of behavioral health care for children, adolescents, and young adults does not function well in providing for the needs of individuals and their families, nor in providing for the state of Connecticut effective and accountable behavioral health care. The task force focused on issues related to lack of equal access to mental health services across all payers, including commercial, self-employed, and public insurers. The task force focused on specific issues of lack of workforce and service capacity, uneven access to care, inequalities in coverage, and lack of consistent reporting and accountability regarding services provided and populations reached. The recommendations generally cluster into 3 large domains, addressing 1, behavioral health workforce capacity, 2, access to behavioral health services in Connecticut, and 3, issues of rights under law for persons with behavioral health issues. So the task force generated 47 recommendations that address 13 areas of our legislative mandate. 29 of the recommendations address the issues of the behavioral health workforce capacity in Connecticut for adolescents and young adults. 13 recommendations focused on issues of access to behavioral health services, and 5 addressed issues of rights under law for young adults with behavioral health issues. So the report's recommendations, when taken all together, we aim to accomplish the following overarching goals. 1, to enhance the identification of early onset mental health disorders for Connecticut's children, adolescents, and young adults. 2, to increase pediatric mental health provider evaluation and treatment capacity. That's basically our workforce capacity goal. 3, to address pediatric mental health care provider quality by enhancing training and expertise in evidence-based evaluation and interventions. 4, to decrease behavioral health care system fragmentation. 5, to increase behavioral health care ease of use for families in need. 6, to enhance mental health capacity in schools to address safety, student behavioral management issues, and early identification and treatment. And 5, to continue discussion on involuntary outpatient commitment laws in Connecticut. So the recommendations of the task force to study the provision of behavioral health services for young adults represents our sincere hope that the legislature will move forward in this important area to improve Connecticut's system of care in the provision of mental health services to youth and to young adults.